This future White Coat podcast is a proud representative of Med Debrief. By students, for students. And representing the pre-meds of medicine, it's the future White Coat podcast. Medical news, helpful clues, several to-dos, and interviews. Follow us on Instagram at Med Debrief. Welcome to the Future White Coat podcast presented by Med Debrief, a Canadian-based student-led service that aims to inform other students about anything medicine and health science related.
Hi everyone, welcome to the Future White Coats podcast. Today I'm here with Dr.Lu, who is an addiction and forensic psychiatrist at the Vancouver General Hospital. Welcome, Dr. Lu.
Thank you for inviting me.
You're welcome. How are you today?
Fantastic.
So today we've had a lot of questions that have come in from our Instagram account at Med Debrief, so I want to jump right to it because we have a lot of content to get through today.
Okay.
So before we get started into psychiatry and what you actually do, let's talk a little bit about med school. So can you maybe describe your path to medicine?
Well, the path to medicine is actually not particularly straightforward. I have a lot of friends in high school. We went to university together. And we all went to different fields, from science to arts to, sociology. And, we all debate what we should do next. And I'm no exception, really. Over the initial few years, I mostly concentrate on science, but also took economics, philosophy courses. Even within sciences, I've done some unusual courses, for example, protisteology, which is the study of single-cell organisms. In my research, I was lucky enough to get involved. I've done some medicine-based related research on electron spin resonance. Over this time, I almost forgot how to say it. And also did some work in oceanography, looking at diatoms and other microorganisms in the Pacific Northwest. So the path to medicine wasn't a straightforward one, but along the way, I meet a lot of people, talk to a lot of folks, and it began to dawn on me that medicine is a field that I would like to get involved in. The idea of helping others, the idea of learning more about the human body, and really, medicine is a huge field with a great diversity. And I kind of learned that within medicine, one can do a lot of different things. It's not just, listening to someone's heart or doing surgery. And the more you learn about it, the more you realize medicine within, the field is a whole universe unto itself. And it's big enough to accommodate different interests. So that's probably the beginning of my understanding of going into medical school. One of the biggest challenges for youngsters like yourselves and future doctors is how to get into medical school. Is this right for you? Obviously, each person's answer is a little bit different. We all have different ways of considering why medicine is the right choice. But there's a few commonalities that I want to point out. Mm-hmm. Number one, you got to be comfortable with people. You got to be comfortable dealing with the unexpected. You have to be comfortable with broad-based knowledge, because medicine is a big field, like I said, and you have to learn a lot. You have to have a degree of self-discipline. But more than that, in the process of going into medical school is making learning part of a lifelong process. How do you get in? Well, study hard. Get to know other people with the similar interest. You guys will motivate and propel each other. You guys will support each other and ask the right questions. It's also important to get to know your professors, the TAs, folks in sort of higher years, and also really be thoughtful about why you go into medical school. So I sat in the UBC selection committee for periods of time. It's not so much what you do as what you get out of it, right? So, between a student who done a lot of research or a student who, work in a retail, both have equal merits. It's about what you take out of that experience in terms of learning about people and how it motivates you and how you look at the world in a broader context that allow the selection committee to say, yeah, this student is great. This student has the potential to learn, to be a leader, to understands the limitation of his action and be ethical. So those are the sort of all of the parameters that we look for.
Interesting. And you made a lot of good points about how, with a field such as medicine, it's always really important to have that ongoing curiosity because, that's what you need when you want to go into such a rigorous field like medicine. So that was really a really good point on your behalf. Could you also maybe talk a little bit about, specifics? So how long you spent in residency, how long you spent in medical school, things like this.
I'm going to talk about the UBC experience, which is a typical Canadian medical school, although Canada also has some schools that are only 3 years, but most medical school is get acceptance after obtaining a undergrad degree. And then once you start medical school, it's a 4-year program. And the first couple of years are usually more didactic learning, more problem-based learning about the basics of the human body, such as anatomy, physiology, and so on. But within that are a lot of sort of case learning that brings real life into why the shoulder joint is constructed the way it is, and what are the potential problems that one can encounter having a complex joint such as the shoulder joints. So those are the sort of first couple of years of learning, and then it takes on what's called clerkship, which is much more direct patient care, being involved in the hospital, being involved with seeing patients, examinations, begin to have more independent decision making. So those are the first 4 years. Not the first 4 years. Those are the 4 years of medical school. Toward the last 2 years, students begin to develop their own interests within subspecialties, maybe family medicine, epidemiology, for example, public health, which is currently in the spotlight with the COVID-19, or psychiatry, surgery, and then one then applies to the various different subspecialties or general family practice. And in that, there are what's called matching programs. So you put your ranking in what you want to do, and the university that accepts you also ranks you based on their choices. And the fitness of match, hopefully you get what you want and where you want to go, but sometimes not. So that's the matching process. That's probably one of the most anxiety-provoking periods in any medical student's life, because so much is riding on it. And once a person goes into residency program, most residency programs are 5-year. The first year is a general rotating year where a resident would work on different specialties that are related to their core specialty. So for example, a neurologist would spend some time in psychiatry, for example, because there's such interaction between the two. Family practice are usually 2 years. Some programs, for example, in UBC, we also have what's called an MD, sort of a research track, where individuals can do research within their 5-year residency with completing a research track that can last up to 7 years. So it's a major time commitment for individual going into medical school. We don't have internships anymore. Back in the day when I was going through, I did have what's called a rotating internship, where we do a whole year of different rotations from internal medicine to surgery. That was really fun. You made lifelong friends during those time. So that sort of described the current Canadian system. Once a person finishes a residency, he or she might choose to do further study, and that's become a subspecialist, and that's would be doing a fellowship. So the fellowship that I completed in addiction psychiatry would be a subspecialty within the field of psychiatry. So, so for example, pediatric cardiac surgery would be a significant steps. And fellowship usually means a higher degree of learning, and their research and other components to a fellowship program.
Interesting. So after you finish, say, a residency or a fellowship, you just go straight into being a practicing doctor as an attending?
Yes. So, for example, in the completion of a 2-year family practice, now you are eligible for licensures within Canada. Similarly, once you've completed a 5-year residency program and complete the examination, now you're licensed to practice within the field that you're specialized in, and that's portable throughout Canada and the territories, and so you decide where you go. Some people might even work in a couple of different provinces, depends on where you live. And there you go.
Okay, wonderful. So now that we've kind of covered a little bit about med school and how you get through and deciding whether you want to become a doctor, let's go into psychiatry itself. So would you mind describing a little bit about your job and what you do?
Wow, that's also a big topic. I talk about medicine being a universe unto itself. So is psychiatry. It's almost like looking at Hubble field, Hubble space telescope. The further in, the bigger the world. Psychiatry is a whole huge field. We have pediatric psychiatry, we have which is called child psychiatry, reproductive mental health, for example, geriatric, subspecialties such as addictions, and other subspecialty that I have would be forensic psychiatry, the evaluations of within the law and medical interface, and so on. Within psychiatry, the job is highly variable, and I think this is a time when I want to dispel some myth for you guys. The traditional Hollywood depiction of a psychiatrist sitting in an armchair talking to a patient for an hour at a time, or doing psychoanalysis, really is only a small component of what we do. Most modern psychiatrists work within a healthcare system, within a team. Many looks after patients both in inpatient and outpatient setting. Many folks within my field really have a diverse workday. So when you say what's your typical workday, I think for many of us there's no such things. So for example, within psychiatry, those who do, for example, community assertive care teams, assertive community teams, ACT teams, they go out into the community, right? So they go look for patients who are disadvantaged or homeless, go into the community, and they may even interview patients on the street corner to provide that level of support. Others might look after patients in the hospital in a general medical setting, such as myself, in what we do consultation liaison work. In forensic psychiatry, we visit jails, for example. The others in child psychiatry would work closely with schools and social services to provide support. So a typical day often involves working with patients in an office on a one-to-one base, providing treatment in a group type setting, providing treatment in a what we call shared care model, where I work with other physicians as a collaborative team. In the hospital, I also work with allied health workers such as occupational therapy, social workers, nurses, and so on, to establish a wholesome evaluation of a patient. So for example, let's say an elderly individual who come in with a significant head injury, who lives by themselves, I might be evaluating the individual for delirium and pain, but in the process, I might also help determine their competency for living on their own, their financial capacity to look after their day-to-day expenses, or their ability to look after their medical cares. Can they consent to treatment? Are they capable of managing to take their pills on a regular basis? Those are very difficult questions. I won't be able to do that myself, so I would have to work with a collaborative team to establish those parameters. So whereas in a community care team, patients might come in from all walks of life, and a psychiatrist would have to work with their family, the patient's family physician, the patient's family, and others. So it's a real diverse experience. So every day is a little bit different. And I right now kind of speak for a more adult-based type treatment. So whereas a child psychiatrist would have even more diversity in what they see. For example, working with teachers, working with other educators, and it's a never changing process. It's not a static job. It's a dynamic work that we often have to adjust on a day-to-day basis.
Interesting. So looks like there's a lot of collaboration involved in psychiatry. And you also mentioned that you are a forensic psychiatrist as well as an addiction psychiatrist. Can you tell me a little bit about what led you to those subspecialties and potentially, the differences between the two?
Addiction is a big field. Addiction is a big part of our common North America struggle right now. I'm sure many of you are aware of the opioid crisis. Cigarette kills more people than all the drugs combined. Alcohol-related problems, including trauma from falls, violence, driving impaired charges, for example, are significant. Certainly, the problem associated with opioid crisis has been a major factor in my decision to choose addiction psychiatry as part of my personal interests. And it's incredibly rewarding because patients with addictions can get better and get back into really productive life. Similarly, my interest in forensics psychiatry stems from the fact that I have a lot of friends who are lawyers. They kind of always tease me about making legal arguments in my interaction with them, and the interaction, sort of the interface between law and psychiatry is a very interesting one, because many of the legal arguments and issues that arise might have something to do with psychiatry. So for example, when an individual, some of the more high profile Canadian cases are related to, is an individual bad or is the individual mad, right? How much psychiatry plays a role, and to what extent psychiatry plays a role in their behaviors and action, and are they still accountable for their action, or are they not criminally responsible, what we call NCR designations. And furthermore, I do what's called civil forensics, which involves looking at the issues of compensation, the issues of how individual sets of action might affect an individual in the longer term. So you can see why psychiatry is such a rewarding field for many of us who are in this job, because there's no end to the interest and diversity of patients that we see.
Interesting. So, it's really interesting to see how psychiatry can reach so many different professions and connect with so many different people. So we've had a question from our Instagram page that I have actually heard myself a couple of times about the difference between psychology and psychiatry. So maybe you can give a little bit of insight into the differences between these two fields.
It's, you and folks within medicine sometimes get that mixed up, right? Psychiatry and psychology obviously mesh well together. I work with psychologists on a regular basis, and certainly psychologists work with us on a regular basis. But there are significant differences. Psychiatry stems from the original effort to look at mental illness from a medical standpoint. So the medicalization of abnormal behaviors. Over the years, there have been pushbacks describing, psychiatry being a form of social control. The most famous is Dr. George Zas, spoke the myth of mental illness. However, the modern day has increasingly shown that in the illnesses such as schizophrenia, autism, bipolar affective disorder, major depression, post-traumatic stress disorder has significant biological underpinnings. And psychiatry looks at mental illness from a medical standpoint. So all psychiatrists have to be a medical doctors first, and we never forget that. Certainly as a psychiatrist, one of the most important elements is to remember that I'm a doctor first. So for example, a patient presented with depression may be due to low thyroid. Hypothyroidism can cause symptoms that are almost identical to major depression. So being aware of the medical conditions that can manifest itself as psychiatric illness are important. Vice versa, patients with psychiatric disorder can mimic medical conditions such as conversion disorders, pseudo seizures, for example. So psychiatry has its root in medicine. Psychology, on the other hand, tends to look at behavior in a mental illness from a behavioral standpoint. So the issues of cognitive behavior disorder, the use of cognitive behavioral treatment, for example, to look at more research-based behavioral changes are pioneered in many ways by psychology. And certainly a lot of the treatment that we employ from a psychiatry standpoint, may it be cognitive behavioral therapy, family therapy, are rooted in many of the research that are conducted through psychology. Psychology can be really helpful in using standardized testing to elucidate the problems that we might encounter from a clinical setting. So for example, let's say if I see a patient with a traumatic brain injury, from a psychiatric standpoint, I might treat medically with antidepressant or medication to help with sleep. But I might require the help of a psychologist to find out what are these specific areas of cognitive deficit that the patient might have as a result of the brain injury. And neuropsychological testing by a psychologist will help identify areas of relative deficit so we can help the patient to find ways to accommodate, to find ways to better ameliorate the problems arise from their brain injury.
Okay.
So I hope that helps to separate the two.
Yeah, it does help a lot to tell the difference. A follow-up question from what you said about how there's been a little bit of pushback on psychiatry. What impacts do you think these pushbacks have on the ability of people who may be struggling with mental illness to come forward and talk to a psychiatrist?
Social stigma against psychiatry is universal. It doesn't matter what country you live in. It doesn't matter you're in China, in Japan, in England, in Canada. Nobody wants to be labeled as mentally ill. So there is a significant stigma that is associated with mental illness. On the other hand, social conformity is a potential problem. We don't want everybody to be the same, right? So for periods of time, how much psychiatry is rooted in social conformity, how much of it is based on mental illness. Psychiatry certainly have its historic wrongs. So for example, as little as 40 years ago, homosexuality is defined as an illness. And currently we really don't see that. And part of the acceptance, part of the rainbow movement, part of who we see each other is a degree of acceptance. So psychiatry, it has its problems historically, right? And we need to keep that in mind. For example, addiction for long periods of time is really stigmatized as a social ill. Whereas now we're really able to identify the biological, neurological changes associated with addictions that makes it a self-perpetuating and self-reinforcing disease, and that there are active treatments that can help individuals overcome the illness of addiction. So the pushback is legitimate in many ways, but yet at the same time, I really want to say that the medication that we give for folks won't change who they are. Many patients with psychiatric illness suffer terribly in terms of physical, personal, occupational impairments. It is not people choose to be living in a different way, so therefore we should leave them alone. Patient with significant psychosis or mania can get into serious physical and personal harms that can be life-changing. So the treatment that we offer hopefully minimize the risk and maximize the benefit. We still have a long ways to go, and I hope those of you who are interested in psychiatry come into the field with a fresh set of eyes and propel this still largely unknown field moving forward.
Yeah, I think that's really important that people understand what psychiatry is and do the research to really have that knowledge about what is involved in psychiatry. So we've talked a little bit about psychiatry, the field, subspecialties. So let's get into kind of like you yourself personally. So what kind of patients do you typically treat?
I mostly work in the hospital, and I also work in a program called the Operation Stress Injury program, which is a federally funded program for veterans and RCMP officers. In my OSI work, I primarily work with veterans or RCMP officers who have PTSD or other psychiatric conditions that arise from their duty to protect and serve within Canada. They're some of the most challenging situations that they have to put themselves in. They're very brave and heroic individuals, but they can also suffer from the impacts of their work. And so I work with that patient group and provide assessment, treatment, and so on. In my work at Vancouver General Hospital, I provide care to a diverse group of patients, ranging from the elderly to young individuals who come in due to many reasons. So, for example, individual might have harmed themselves in some way and have to be admitted to the medical and surgical unit. I would provide care to them. Or individual who has been diagnosed with a devastating medical condition and they're struggling to find their own voice and how to cope with such a life-changing disease. So, for example, individual who might have acute diagnosis of cancer or suffer a spinal cord injury, I provide help to those patients. And also many elderly individuals who come in that require assessments of competency, assessments of depression, dementia, or delirium. So it's a big group of patients that we assess. As I mentioned, I work with a highly competent group of psychiatrists and Allied Healthcare. We work well together as a team, and one of the most important thing to remember when all of you go into medical school is never forget the help of your teams and colleagues, from nursing staff to occupational therapy to the unit clerk, who help with organizing all the orders and making sure everything's run smoothly. So not only do I work with a diverse group of patients, but also work with a diverse group of healthcare providers. So remember, respect, responsibility, and support are an important part of our job.
Mm-hmm. And you mentioned, you meet a really big range of patients who suffer from, a variety of illnesses. One question that came up is, do you get emotionally affected by your work, and does it ever get easier to deal with, the emotional impacts of the job?
I think this is not unique to psychiatry. We all get attached to certain patients. Because we see them longitudinally, right? When you get to know somebody over periods of time, doesn't matter if you're a dermatologist or a psychiatrist, when bad things happen to your patient, you take it to heart. And that's one of the very challenging part of our work, to tell a family member that their young son or daughter has been diagnosed with schizophrenia, or that they might have harmed themselves in some way, can be very, very difficult. It requires an awareness of our skills, our own personal reactions and emotions. And luckily, the field of psychiatry are very good in terms of helping folks to learn to modulate and learn about our emotion. But also it's important to keep family, friends in mind, be active, exercise, enjoy life, but also as a way to balance out the difficulties that goes along with work. But there are times where no amount of those preparation can help one deal with some clinical impacts or patient losses. And we all grieve in our different ways of patients that suffer hardships or have negative outcomes, and that's a difficult part of our job, and it's not unique to psychiatry. So do not choose psychiatry because you think, oh my God, I'm going to get attached to patients and what am I going to deal with it. In all branch of medicine, we have to deal with that.
Mm-hmm. And adding on to that, what would you say are kind of your favorite or least favorite parts about the job?
The favorite part of the job is always working with patients because they surprise you. And the most difficult part of the job is also working with patients because they surprise you. And how do you manage that? And also the other thing is each day keeping up with the informations are very difficult. Medicine is a fast-paced, moving condition, field, we always have to learn. For example, COVID affects mental health. COVID affects respiratory care. COVID affects infectious disease. COVID affects general family practice. So that part of the job is always the most challenging, keeping up with up-to-date information, and yet at the same time finding time for family, friends, and patient care. Those are not easy balances. So I think the most, I wouldn't say least favorite part of the job, rather I would say the most challenging part of the job is keeping up and making sure one has some degree of balance, while at the same time being a good physician.
Awesome. So, that's kind of a lot about the job. And since we have a little bit of time left, we have a little bonus question that we got from our Instagram page. And I think this is a question that a lot of us will relate to, especially our audience is mostly comprised of incoming first-year students and, graduating students. So Dr. Lu, how do we as human beings deal with, things like social anxiety or build the confidence to meet new people?
Oh boy, I'm still dealing with that right now. Social anxiety is very, very common, especially for young folks moving on to a different stage in life. You're moving from the protective environment of high school to university, where you are exposed to a whole new group of people. I think number one is to remember different degrees of anxiety. Social anxiety, like all anxiety disorder, comes in a spectrum. If it gets to a point where you can't get out of the house, where you literally find yourself forgoing your dreams and aspirations, forgoing your basic education, you need help. And I would recommend individuals who suffer that to talk to your family physician as an initial, because they're real good treatment, ranging from psychological treatment that I mentioned earlier to medication management that can help with social anxiety. But to a lesser degree, that more common social anxiety that many of you guys have going into university really is push yourself to try new things. Remember to modulate your emotions. Remember the folks that you're meeting probably are dealing with the same thing, and be open about your own emotion, and remember you have an intrinsic value to who you are, and keep that in mind. And people are going to make mistakes. People that you're going to meet might say things that they don't really quite know, or that might potentially initially sound hurtful, but they don't know you as much as you would like them to. And in university, everyone's trying to kind of feel each other out a little bit in that social interaction. So be mindful of your own mistake and the mistake of others, and be forgiving of that. I think that's probably the most important part to allow all of you to have greater social interaction. Be forgiving of yourself, and I think that's probably the most important statement I can direct to you. And same thing for applying to medical school. If you make one mistake in one course, it's okay. We never focus on a single course. Nobody does that, right? We look at it in a longitudinal, what is the body of work of this individual do. And if you can build up enough of credit along the way, we overlook those mistakes, because to make mistake is human. And so dealing with social anxiety is the same thing, and making application to medical school is exactly the same thing.
All right. Thank you so much for your answers. I think they're really relevant to a lot of people who are probably listening at home right now. So I think a lot of the points that you've made today are really insightful, and I hope that to our viewers listening at home, whether that's on our YouTube channel, on our Spotify, or our Instagram page, that you've gotten a little bit out of this podcast today, whether that's, if you're interested in psychiatry and med school, your social anxiety issues, whatever it may be. I hope those of you listening at home today are, gaining a little bit of knowledge from what's been said today. So thank you for joining me today, and hopefully we'll have some more podcasts for you all soon. And a big thank you to Dr. Lu for joining me on this podcast today.
Well, you're most welcome, and good luck, everyone. And it's a big world waiting for you out there.
All right. See you guys next time. Thank you.